William Wilberforce is a man that over the years I have looked to as a role model and an example of what public service should be and what public servants should be. Wilberforce served as a member of the British Parliament from 1784 to 1812. This followed an early career marked by what he described as doing nothing of purpose. Wilberforce then went through a transformational period of self-reflection and emerged with a deepened faith, a greater moral courage, and an unshakable passion for ending the slave trade. He said that, and I quote, "So enormous, so dreadful, so immediate did the slave trade's wickedness appear that my own mind was completely made up for abolition. Let the consequences be what they would. I from this time determined that I would never rest until I had effected its abolition." It took Wilberforce 20 years of blood, sweat, and tears, and even death threats. But he succeeded in pushing the House of Commons and the House of Lords to put abolition into the law when the Slave Trade Act of 1807 passed. I believe today, just 2 hours from now, we will have a William Wilberforce moment facing the United States Senate. Through a series of video releases over the past few weeks, the American people have learned about the shocking and barbaric practices Planned Parenthood uses to terminate innocent human life. In several different videos, senior Planned Parenthood officials openly and candidly discuss the organ harvesting of fetuses. In one video, the senior director of medical research for Planned Parenthood explained the process by which aborted body parts are harvested. I'm not going to describe that process on the floor. I talked about it last week, but those who have seen the video, those who have read about this practice, it's abhorrent to hear the cold, calculating consideration of how best to dissemble, to tear apart, to rip apart, so that a growing life, so that they can harvest certain body parts and then sell them for research, and negotiating prices. The calculated, inhuman lack of any kind of emotion. It's like describing to somebody how they can go to Home Depot and how to pick things off the shelf. Let's see, what does this cost? Okay, no, maybe we can get a better price for this. But in this case, we're talking about living human tissue being taken and harvested and sold. So let's consider for a second, what's the bottom line here? The bottom line is we're talking about an organization that is embracing the dismembering of a human life with taxpayer support. Millions of Americans who have seen these videos and heard these orations are rightly outraged by these videos and the cavalier attitude that Planned Parenthood has toward precious human life. Americans in all walks of life, Americans of different faiths and of maybe even different political parties, abhor this. And then we learn that our tax dollars, our hard-earned tax dollars, are sent to an organization that practices these methods. Surely we can come to a conclusion that this is not something which violates the faith and beliefs of many millions of Americans, that this has to be subsidized by the federal taxpayer. Now, over the past few days, we've heard many who say, well, look, I object to what Planned Parenthood is doing here, but we can't afford to stop funding many of the very important women's health services that Planned Parenthood provides. And this is an important consideration, because I'm sure every senator here believes that ensuring all women, regardless of their status or regardless of their financial situation, all women deserve to have access to vital services that healthcare providers provide. The interesting thing here is that we have, I think, a very good answer to that question. Because the bill before us today that we'll be voting on, offered by the presiding officer, Senator Ernst from Iowa, addresses these concerns. Her legislation would transfer the money that is taxpayer money that is provided to Planned Parenthood. It would transfer to a whole range of women's health care providers. I have the bill here in front of me, very simple, very basic bill. I want to read from this bill. State and county health departments, community health centers, hospitals, physician offices, and other entities currently provide and will continue to provide health services to women. Such health services include relevant diagnostic laboratory and radiology services, well child care, prenatal and postpartum care, immunization, family planning services, including contraception, sexually transmitted disease testing, cervical and breast cancer screenings and referrals. And the bill goes on to say many such entities provide services to all persons, regardless of their ability to pay, and provide services in medically underserved areas and to medically underserved populations. So, what is being offered here and what we will be voting on this evening doesn't take anything away from women's ability, regardless of their financial situation or where they live, to have the services that are needed and need to be provided to ensure their health and the future health of the child that is being born. So I don't understand, and by the way, in the United States there are 5 times as many community health centers as there are Planned Parenthood operations. In my own state, I think the numbers are 108 community health centers in urban, rural areas all throughout the state of Indiana, 5 times the amount of Planned Parenthood facilities. And so the issue of, well, we're denying women needed health care simply is not the case under this legislation. The barbaric practice of conducting abortions in a way that promotes harvesting fetal organs or profiting from such practices has no place in a modern society. Planned Parenthood's practices, I would suggest, should not receive a dime of taxpayer money. The question is, do we want taxpayer dollars to continue to support an organization that treats human body parts like a product on the shelves of a store? And today the Senate will decide. Will we fight for what we believe is morally right, or will we stand by and allow the trivialization of life to continue? And so I'm here to urge my colleagues to vote yes on this vitally important legislation that we'll be taking up in just less than 2 hours. Madam President, I yield the floor.